Well, let's get started. Welcome everyone to Winnipeg Construction's live panel discussion this morning, focusing on COVID and preparing for the outcome of a COVID in your workplace, or all of our workplaces. My name is Ron Hambley. I'm the president of the Winnipeg Association and the moderator for today's discussion. Hope it's interesting and a little bit fun. Today we're joined by, as I said, over 300 members from around Manitoba and I suspect elsewhere, and an accomplished panel of guests to discuss a topic that is becoming more and more critical each day in our province. We currently have in Manitoba, we currently have over 1,700 active COVID cases with a test positivity rate of around 5%, which clearly indicates we're in the second wave of this thing. Each of those active cases represents so many numerous close contacts and even more incidental contacts we will have to deal with. So putting aside the obvious concerning health impacts of COVID, for those who do test positive, there are numerous impacts, non-health impacts for people and businesses that do not test positive but are somehow involved. Each close contact will have an immediate employment impact due to mandatory isolation and testing requirements. This will obviously impact people's financial and mental well-being, even if they don't test positive in the end. As Manitoba's situation deepens, our discussion today is an important one and aims to help the industry discuss lessons we've learned in our first round over the last 6 or 7 months or so, and hopefully plan for the future next few months as we move forward. COVID is obviously having a major impact on construction projects in our province. We've been living with this pandemic now and have had to find several ways to innovate and collaborate and to keep projects running. And we've been successful at that, I think, and moving things forward in the province. Today's panelists will share their thoughts on some of these challenges that the pandemic has presented, but more importantly, we'll discuss how to prepare your construction sites with best hygiene practices and what you need to do if there's a positive test in your office or on the construction site itself. Today's webinar is scheduled for about an hour with approximately 50 minutes dedicated to our panel discussion. And then we should have about 10 minutes for questions. So feed them to the chat line and our producers, Daryl and Jack, will bump them up to me and we'll see if we can't deal with them in that last 10 minutes or so. Okay, we are recording this, a little bit more information that later on where you can get a hold of it if you want to, if you have to jump out early or if you want someone else to have a look at today's discussion, we'll let you know where you can see that. So let me introduce today's panel discussion. First of all, we have Kelly Wallace. Kelly's at PCL Constructors Canada in Toronto. He's the Toronto Vice President and District Manager, but he is a local graduate of Civil Engineering Technology at Red River College, our own college here in Winnipeg. He began his career here in 1998, progressing to Senior Manager before moving to Edmonton. He has managed many high-profile healthcare projects, progressing to Senior Manager before moving to Edmonton. He has managed high-profile healthcare projects and special projects. In 2013, Kelly moved to Toronto as PCL's operations manager and is currently vice president and district manager in Toronto. Kelly will be speaking today about the impact the shutdown had in Ontario and on construction sites and what can be done going forward to compare if that happens again. Andrea Hohne is also with us today. She's with Workplace Safety. She's a trained occupational hygienist with Labor and Regulatory Services of Workplace Safety. She has a Bachelor of Science from Brandon, a Bachelor of Technology and Environmental Health from BCIT in British Columbia, and a Certificate of Infection Control from Queen's University in Ontario. She began her career as a certified public health inspector and has since worked as a safety and health officer prior to focusing her career on career hygiene or occupational hygiene. Andrea is also involved in lean facilitation. So welcome, Andrea. And of course, Sean Scott, the Executive Director of the Construction Safety Association in Manitoba. Sean has been influential in construction safety, not only in Manitoba, but around the country. He originally started as a safety technician in 1999, was promoted to the Executive Director in 2002, and has served as the Construction Safety Association, the Construction Safety Association of Manitoba for the past 15 years. He's been pivotal in building an outstanding safety association that we have and are very proud of in Manitoba. Over the past 20 years, Sean has also served as the chairperson of the Canadian Federation of Construction Safety Associations and has participated on numerous committees such as Skills Compliance, Skills Competence Canada's the skills competitions as we know them, the National Safety Committee, the Canadian Construction Association Goals 2 Committee, and of course the WCA External Rate Setting Advisory Committee. So Sean's well qualified to join our discussion as well. So welcome to our panelists, and welcome again to all of you. Let's get on with our discussion. Starting perhaps with Kelly in Toronto this morning, you've experienced an industry-wide shutdown, Kelly, in Ontario. Maybe not complete industry-wide, but certainly a significant shutdown of the construction industry in Ontario and part of Quebec. What were the most significant impacts to those projects that were already underway? And thinking back to those dates, March and April, what would you do differently?
So first, thanks for having me, Ron. Just to give you maybe a little bit of a synopsis of how things kind of rolled out in March. So we were running roughly 60 projects at the time, and when the government shut down some of the non-essential projects, it impacted roughly 50% of our projects. So we went from running 60 projects down to 30 virtually within a weekend. So needless to say, that had its challenges making all our sites safe and secure, but not really open up to any of the workers. But you know, when I take a look and think back to what some of the greatest challenges were for us, I'd say first and foremost was the amount of information coming out, whether it was from the press or health authorities. And you know, for all of our sites that were operational, you have a bunch of frontline supervisors and superintendents that are trying to navigate all of this information, and they're trying to really help curb the anxiety of all the workers. So I think a couple of the things that we were thankful for is, you know, we typically try to keep our sites very clean and very safe. So I think the workers had a good comfort level to start. And so we could really focus on over communicating what the plan was going to be. So what we quickly did was we pivoted to a regular daily touch point with all of our superintendents and all of our senior management team to give them updated information. We also had a daily update with all of our VPs across Canada so that we could share lessons learned from province to province, because it was evolving quite quickly. So I would say those were some of the things that we did quite quickly. One of the lessons learned, I would say, that we took away was that, you know, and I think Sean's going to share it a little later, but just the protocol when you had a presumptive case or a positive case on your site. You know, we were lucky we had very few cases, and we still to this day, we've been lucky, I would say. But one of the things that we did do is we put together a decision tree that we actually kept at the executive level, so that if there was a presumptive case on the site, we took the call, the VPs took the call directly from our superintendents, so that we could, you know, listen into the anxiety level, listen into their concerns, and really try to address them on a case-by-case basis, but also provide consistency across the country as far as you could, based on what the health regions were telling you. So I would say that definitely the biggest challenges were around trying to manage supervisor anxiety at the workplace and overall worker anxiety due to misinformation.
And I mentioned that not all the construction sites in Ontario were shut down. How did they differentiate in sites? Because we may well see that here in Manitoba at some point.
So what they did is they take a look and go, what sites are you building that really provide essential services to the community? So anything that was healthcare was kept running. And conveniently enough, we had two mega healthcare projects, one that was roughly 800 million, one that was 400 million, that were really like within inches of getting to substantial completion. So for the government, those were going to be adding net new beds almost immediately. So for them, it was essential to keep those going. The other thing that was kept going was anything that provided essential infrastructure from transportation perspective, or correctional, and then the residential the residential space. So any of the residential high-rise projects that we had kept going. But if it was commercial office space or retail, that was the kind of stuff that got shelved quite quickly.
Okay. And sort of a final question: what are you doing now to prepare for the future? If you have a specific site that gets shut down, or if your province shuts part of the construction industry down again?
That's a great question, because one of the things, there's pros and cons for being with a big outfit. One of the pros is you can get lots of resources focused on kind of specific items. And one of the things that we looked at across Canada was, okay, what's our protocol in shutting down a site? Call it, we like our checklist because it keeps us kind of on task, but we had a specific kind of shutdown protocol for a site because, maybe to the general public, it might seem easy to shutter a site, but most sites, I think everybody on the call knows, you've got temporary facilities that are still running, whether it's, heating and lighting. You've got your hoarding. You want to make it secure to the site. So one of the things that we have gone through already is we've got a good understanding of what it takes to shut down our sites. The other thing we know we have a good idea on is, what recourse do we have by the contract? So, a lot of contracts will give you time for an event like this, but they may not give you any money. So, we have a good understanding of what our recourse is in each case. I would say those are some big items that we understand. The other part that we've had to do is, when you go from having, call it 600 salaried staff working every day to running half the projects, you start to take a look and go, okay, what do you do with staff that aren't having engaging work to do? So I think for the people on the call, maybe is to do a little bit of recon on what recourse do you have in terms of employees using up vacation or unpaid leave. So those are some of the things that we've gone through now. So we've got a good understanding, so we don't have to relearn that. So those are some of the things that I think we're prepared for more so this time.
Interesting. Very interesting. Thank you. Over to Andrea now. I'll direct this next few questions at you, Andrea. Generally, construction sites have pretty strict rules on who can be on the site and when. What is your process for choosing a site to visit, and what arrangements are made with the prime contractors when visiting sites these days?
Perfect. Good morning. First of all, thank you for the opportunity to speak to everyone online today. With respect to your question, there's certainly a number of reasons why an officer might be present on a job site or construction site. We might be triggered to do an inspection for a complaint or a tip, maybe a serious incident, or a proactive approach for one of our work plans. There certainly may be circumstances where an officer would make arrangements with a prime contractor or a building owner or both. For example, if an inspection requires the presence of a specific person, or maybe an officer has been at the site previously and there was nobody on site to consult with. So there certainly may be circumstances there where we would be in contact. For the most part, COVID hasn't changed our approach to how we go on to sites. However, all the officers that we do have are trained with respect to COVID, and we'll continue to visit the site trailers or the site office when we get to the site to announce our presence and follow both own internal safe work procedures and whatever's on site for that project site.
Thanks for that. So what does an inspector, when you do attend a site, what do you want to see and what you don't want to see? And maybe do you have any examples? I don't want to put any companies on the spot, but if you had any examples of some really good situations and some unfortunate situations?
Sure. So when it comes to inspections and inspections that are specifically focusing on COVID, it's certainly important that workplaces, employers, and workers complete a risk assessment, specifically for COVID, to determine what the actual risk might be to the workers at that particular site. And of course, that risk assessment taking into consideration all of the information that's available. So thinking about association information, current public health orders, or recommendations that are out there by the various public health bodies, which we know changes relatively quickly these days. In addition to the risk assessment, an officer would certainly be looking at which control measures have been implemented in response to any risk that's identified. Again, taking into consideration recent information from public health. So we would look at things such as, is there a process in place for looking at your high-risk workers on the site? Is there a process for accommodation if necessary or if appropriate? Do workers know what those high-risk categories are that public health has outlined? Is there a program in place for health screening of workers or any of the other individuals that might visit the site, temperatures, questionnaires, etc.? Is there physical distancing considerations implemented at the work site? For example, looking at the tasks that are being completed, the common areas, and how physical distancing is approached in areas that a number of workers might be accessing at the same time. Do we share vehicles? Are workers cohorted? Are breaks staggered? Are physical barriers used or face coverings, for example, used as a control measure when barriers are not reasonable and workers are required to work within that 6-foot distance? Personal protective equipment, certainly would be looking at the procedures that are implemented for sanitizing and cleaning or general hygiene at a work site. So that might include things like equipment, shared tools, how they're sanitized, how workers and other persons on the site have access to hand wash facilities, sanitizer, etc. And the final thing may be focused on training and education. So how are the folks on that site educated with respect to COVID, and which procedures are implemented on those work sites specifically for the tasks that are being undertaken? So there's a number of things that we would certainly look for a site that would be considered a lower risk.
Sounds like you have a bit of a checklist there. Could you share that with our industry? Is that something you typically share?
Good question. We don't technically have a checklist, so to speak, but there are a number of excellent resources. There is a specific one from Manitoba Health. It's a risk assessment for workplaces, and it's an excellent tool for a prime, a sub, any of the workers that might be involved to walk through all of these various areas to assess the risk, and it gives excellent examples of control measures that are reasonable for the industry for different types of sites.
One of the really important initiatives we undertook early on in this process was to create a practice bulletin that talked about hand washing facilities on ICI, the larger, medium and larger construction sites. We wrote a bulletin hoping the owners of construction would see it and include requirements in the tender conditions so that everybody bidding the job was bidding sort of at a level playing field. I'm not sure how successful that has been. It's certainly a difficult issue on construction sites with the availability of water and power in some cases. Have you seen any difference with regard to hygiene on construction sites post-COVID?
I don't know that I would say that there's different provisions observed. However, I can certainly say that there appears to be quite a focused effort on behalf of the primes, anybody that's on site and responsible to ensure that workers have access to those types of facilities. Certainly seeing a definite focused effort to ensure that those facilities are available for use where reasonably practicable, taking into consideration it's not always something that's easy to access or implement. There certainly are the requirements under the legislation that speak to hand washing facilities on a job site unrelated to COVID, but there are also recommendations very strong from public health that speak to hand hygiene and the provision, access or availability on a site. So a site might want to take into consideration how reasonable it is to access those facilities, but also the size and scope of the project, the type of tasks being done, the duration of the project, where workers might be located, access points for hand wash provisions to help them identify what's reasonable for that site for the implementation of washing and other provisions such as sanitizer.
I think today it's a little easier to find hand sanitizer. In the early COVID days, you couldn't find that, and for a site that didn't have water or hand sanitizer, it was pretty difficult to deal with that. So for those that are for you, Andrea, but for those contractors that may be watching and thinking about this today, if they're involved on a construction site that's simply not following the rules, what do you suggest that they do?
So certainly the first thing would be for any worker on a site to be familiar with the process that's implemented for that site. So who you go to if you have concerns, your safety person, etc. on site. However, workers also have the option or opportunity, and it's recommended if there's still concerns that aren't addressed, that workers can contact Workplace Safety and Health through the client services intake and address their concerns or bring their concerns forward in that fashion. And of course, that's through the general intake 204-957-7233 number.
All right. What happens if there is an infraction on the site or it's identified that a company isn't following? Or actually, one of the questions we've been having on the sidebar here is what happens if there is an individual that simply refuses to wear a mask?
Okay, well, I'll answer the first question there. The first question about violations and what happens on a site. When an officer visits a site, they will always provide some type of documentation to outline the inspection and the circumstances or observations from the inspection. It certainly may be in the form of a report or an improvement order or a stop work order, of course, depending on the risk identified at the site and the type of contravention that might be observed when they're on site. Everybody on the site certainly has responsibilities under the Act and the regulation. So that documentation, in whichever form it comes out in, could be issued to a prime contractor, could be issued to any of the subs or a combination of both, depending on the circumstance. When it comes to your question about mask use, I know we do have a question about that coming up later, but if a person refuses to wear a face covering, if I'm not mistaken was your question? So there's different options. There's nothing that says it's a mandatory must use in all circumstances. Face coverings are one example of control measures that can be implemented in a workplace. So it's really going to be dependent on what provisions are in place and what expectations are in place for that particular job site. Again, everyone has responsibilities, a prime, a sub, and workers, to ensure that the provisions are followed through on and implemented, and that folks comply with what's expected of themselves is what tasks they're doing.
Thanks for that. Maybe we'll circle back to that question from the other panelists in a minute. Over to Sean Scott now. Like one of the conversations we've been having in the last couple of weeks is what happens if there is a positive case. We focused our efforts on making sure people were safe and following all the right precautions, but inevitably we're going to have those questions on construction sites or in construction offices. So maybe Sean, would you go through the process of what happens if a positive is identified on a site or in an office? You're muted, Sean.
Is that better? You missed all that. It was fantastic information, that first 30 seconds there. Anyway, this chart actually just literally walks through, okay, what happens? Oh no, somebody's actually tested positive. What are we actually going to do? So we actually walked this through a process. We've had a few companies actually have this question posted to us. And as we try to provide information, resources, and tools and training to help you meet your responsibilities, this is, I think, a very nice visual that identifies. And this is just the start. What I'd like to do is actually literally walk you through. So if somebody tests positive, it's very, very important to note that it's public health that will actually give the direction in terms of what needs to be done. So an individual, if they have been tested positive, public health will notify them and advise them that they need to actually self-isolate, and then they begin a process of investigation themselves. So depending if they identify there's a potential of transmission or close contact of work cohorts or people that the person's working with, they will notify the employer. And then from there, the employer obligation is to actually notify any other individuals of a potential exposure. So one of the things that is very, very important here that I just want to clarify, and it goes back to the Workplace Safety and Health Act, is everyone here in Manitoba has what they call a duty to share required information. So that's anything that could affect the safety and health of others. And then also Clause B actually of, I'll just identify it here as 7.5. B, that is necessary to identify and control any existing or potential hazards with respect to workplaces, any process, procedure, biological or chemical substance. So if you've been identified or if you've been notified that there's a potential positive case, you are aware that there's a potential hazard and you do have a duty to share required information. So from that, you notify your employees or any potential personnel actually on site that there was an actual positive case diagnosed of a worker, and then that information you now forward off to individuals, and it's the determination if they feel that they are symptomatic, if they need to be tested, and what happens. So this is just a process in terms of the different ways to go through, and more important, I'd actually like to walk you through the actual document that gives you the step-by-step. And the reason why I believe this is super important is safety in itself, just safety management in a nutshell, is literally the identification, the communication, and the control. So if you've been identified there's a hazard, you communicate to those affected, and you need to put in place some type of control. So step number one is if you've been notified that there's been a positive COVID case yourself, public health will conduct their own contact tracing and to determine if there's other potential close contacts. And the definition of close contact is if there's been significant and prolonged contact with a person who has tested positive. And that significant is within 6 feet or 2 meters, and prolonged is greater than 15 minutes with an individual. If you're deemed to be a close contact, public health will direct you to self-isolate for 14 days since the last contact with that individual that was positive. So from there, obviously the employee that has tested positive will be directed to isolate, and there's little variance in the numbers here. If you're positive, you have 10 days to self-isolate, and then you can come back if you're 24 hours symptom-free. And then if you're a close contact with an individual, it's 14 days of self-isolation. And the little note here at the right underneath where the big bold definition is, employees identified as close contact or tested should not be in the workplace. And they also should also be reminded that even if they get a negative test, it's still from the 14 days since their last close contact. The next step is to actually identify. So you've been told that an individual is actually positive, has tested positive. And as mentioned, public health will conduct their own investigation to determine the close contact. The important thing to remember here is that depending on when public health contacts or completes their investigation, there could be a lag between 24 to 48 hours before they conduct or complete their investigation. So as an employer or a prime contractor, as you've been presented with somebody, you know there's a potential hazard here. So you are obligated to actually follow through and do your own investigation. Highly, highly recommend that immediately conduct your own investigation to determine the contact, if anybody on your job site or in your office may have actually been deemed to be a close contact. So a couple of things regarding the investigation, just that ABCD. Identify the dates when the positive employee was actually in the workplace, determine their activities, and then make a list of any employees that you believe were in contact, either the coworkers or work groups or visitors, and the duration of the contact, and validate whether or not hygiene and physical distancing protocols were in place. And the reason why that's important is when public health will contact you, they will literally ask you those questions. Again, they're going to confirm their schedules, the tasks, and then who they're actually, the activity. And I try to identify, well, were they actually within 6 feet of this individual for greater than 15 minutes? And if they were, they would be identified as a close contact. So that's your investigation. And part of that investigation is to also keep a list of this, because when public health, if there's suspect there could be potential transmission in your workplace, they will definitely contact you and follow through and be asking you these questions. So as you do your investigation, be prepared to share that information with public health. And if we look on the next page, the next one is communication. So you've done your own initial investigation. It is very, very important to notify personnel on the job site. Obviously, if you determine that they may have been a close contact, you'll also have a general communication that actually goes out to all employees and any other individual that may have actually been on the workplace at the same time. So one thing just want to make very, very clear and important is make sure that even though you will be identified, or you will know who the person actually is, do not share that name of the individual with anybody else. What our direction from public health and the government is, the less information on this is the better, because this is public health, or this is health information, and you should not be sharing the name of the individual. Now, that being said, some of the things that you want to do is, if you have identified and determined through your investigation there's a potential close contact with an employee, you would obviously need to actually advise them that, hey, we feel that you might be a close contact, and ask them to self-isolate and monitor for symptoms. If they have symptoms, to actually go get tested. And that will be, again, because if you determine they're potentially a close contact upon public health's investigation, they will tell them exactly the same thing, is to isolate and get tested if they feel that they have symptoms. So there's definitely a communication that needs to go out to personnel, and a general communication. And again, if you're on a project site, you would identify the date and the time the individual is actually on the project site, and if possible, depending on the name of the site, the actual area that the positive contact employee was in place. So that's just identify, communicate, and then the control aspect. The control aspect is, again, just following through. Okay, now what are you actually going to do? So generally speaking, you have your protocols that you should have in place in terms of hygiene and physical distancing protocols. The other important factor to consider is proper cleanliness or disinfecting of any tools or equipment or areas where this individual was actually in place. What we have actually identified and put in place is, we've noted that the virus could live up to 3 days. Now, there's a lot of different studies out there, and this is just one resource that we found was a credible resource. So the 3 days is a period in time in terms of, you want to ensure that the disinfectant does take place. So again, the hygiene and physical distancing protocols is very important to remind people of. And then if we shift over to the last page. We're going to ensure that the communication that we actually put in place is reminding of individuals to self-monitor, and that's where that little graphic came back. Self-monitor. If you feel you have symptoms, go and get tested, and obviously the isolation if you do have those symptoms and or if you are tested positive. So one thing that has come up again is, depending if there's a potential link or if there's a potential transmission where there could be 1 or 2 cases of employees testing positive, workplace safety and health will definitely come down and validate and review what your pandemic plan is. And we have and I just want to add, we have a lot of this information and tons of resources where we've either created or shared with, as Kelly had mentioned, people from across Canada, our sister associations from the Canadian Federation of Construction Safety Associations, as well as the Canadian government and other public health agencies. So there's lots of resources that actually walk you through what needs to be and what needs to be done. So one of the questions was, well, we went through this whole process, and if somebody actually now needs to come back to work, what do we do? The important aspect of this is, again, in bolded, is that public health here will advise a positive employee or positive person who tested when it is actually safe to return to work. Generally speaking, it's going to be following 10 days of isolation and 24 hours of symptom free. And it is not necessary for an employee to go get retested to make sure that they're actually negative. Again, public health will advise them when it's safe to return. And generally speaking, it is following the 10-day isolation and 24 hours of symptom free. So lots of information, and I kind of glossed through that document, but that document itself, if you go to constructionsafety.ca, we actually have a COVID resource page under our resources that has tons of information that's very usable and practical in terms of what needs to be done.
Thanks for that, John. And I know we've shared this newest document via our own email, and I'm assuming it's also on your website. So just sort of a follow-up question on that side. A question over to Kelly is: have you had any experience with positive tests on in your employees on the site or in the office?
We've had experience with both. So I'll start off with one of the more recent ones where we had an office case. So we had an employee come to us and identify that they had tested positive for COVID. Fortunately, they had only been in the office for roughly an hour, and all their contact had been deemed indirect. So we went through and identified everybody that the employee had been in contact with. And then we, in turn, contacted each of those employees to identify you've been in contact with someone indirectly that has tested positive for COVID. So they were all moved to a self-monitoring situation. None of them had to self-isolate at that point. So they all monitored. We kept an eye on them. And then what we did was we communicated to the entire office, very detailed on what had happened, just because for us, we figured that the more transparency we have, the more people are aware of, the less questions we're going to have. And it went quite well. So like I said, we communicated to everybody what was going on. And then we also took an additional step. And we, over the course of that night, we disinfected our entire office. So that was within the office confines. And then we've had a few site ones. On one of our larger sites, we had a bit of an outbreak amongst one of the demolition crews. And so what we did there is same idea. We worked through the contact tracing, figured out, okay, who had direct contact, who had indirect contact. Anybody that had indirect contact was advised and they self-monitored. Anybody that had direct contact went into self-isolation and obviously monitored for symptoms. And then what we did on the site, we were lucky enough that we could kind of isolate the building and call it the lunch facilities that this team had been working in. And we went through and did a full disinfection of the building and their lunch confines. So, and again, the communication, of course, like Sean said, you're not going to identify individuals' names, but we were very transparent on the steps that we were taking and the fact that anybody that had direct or indirect contact had been identified and contacted. So, and of course, you're bringing in the healthcare authorities in terms of looping them in on the contact tracing for that.
See, good answer, Kelly. One of the questions we got on the chat line involves whether or not an individual contracting COVID on the construction site, and whether or not that's sort of definition of a serious injury, or whether or not it's a WCB claim. Does anybody want to jump in on that one?
Yeah, I can definitely. This is again part of our COVID-19 resource page, and this is literally directly from workers' compensation. And the question is COVID-19 work-related? So most instances of COVID-19 are not work-related. However, the nature and type of your work may determine if they're at a greater risk of contracting the virus, depending on what what it is. So the long and the short of it is, I think the question was literally, if you're asked to self-isolate, is that going to be a claim from WCB? And generally speaking, WCB does it on a case-by-case basis, but generally speaking, if you contract the virus through what they determine to be work, that would be a compensatable. This virus is communal in terms of its community spread, so it's very, very difficult to pinpoint that it was due to a work-related exposure. If they do that, it would be compensatable. But again, they'd have to, not just that you're self-isolating, but you would actually have to I forget the actual term, I can't even think, you have to contract the actual virus itself to be entitled to a claim.
I think the answer to that is as well, though, if you have an employee that is questioning it, just and get them to contact the WCB and file a claim. It's not going necessarily be automatically accepted. They'll adjudicate it like they normally would. I know they're pretty sensitive to this particular issue. Different boards across the countries may handle it differently. But as Sean says, this is a virus that spreads in the community. You would have to have some positive demonstration that it was contracted in the workplace. There may be instances, I can think of the food processing industries where that may be the case, but I think I'd leave the ultimate decision to the WCB on that one.
Yeah, sorry, Ron, I just want to add, and I should have scrolled down a little bit on my side screen here. The question is, does the WCB cover workers during self-isolation or quarantine when they are not sick? And the answer is no. The WCB does not provide coverage to workers when they are quarantined, self-isolating, or sent home on a precautionary basis and are symptom-free. However, should a worker develop symptoms during quarantine, they may be eligible, right? So anyway, and this is directly from WCB site. So going back to Ron's point, if you're concerned, you can always identify or put in a note saying, hey, this is potential, and they'll follow through with it.
Exactly. A topic that's coming up more frequently, and it certainly was in the news last night and this morning, revolves around contact tracing. And obviously, to reduce the spread of this thing, effective contact tracing is very important, obviously. Have any of you seen, Kelly or Sean or Andrea, have you seen any particularly effective ways of tracking workplace attendance to assist in contact tracing?
So maybe I can jump on it, Ron, and don't feel bad about getting those words mixed up, because I think as contractors, it's those two words can get interchanged pretty quick. I think I've seen it. Interestingly enough, I was at one of our sites in Edmonton a few weeks ago, and one of the things they have there is each of the workers actually fills out a daily screening through their phone before they're admitted to the site. And so what that's allowing them to do is identify exactly who was on site every day. And then from there, they're also asking the foreman to kind of track where they're working, so that they can identify, if all of a sudden a worker is identified as being COVID positive or even having symptoms, you can go back and take a look at who was on the site that day, who may have been working in the same areas, stuff like that. We have that in our office. So I come in every day, I fill out my little fancy form on my phone, and then people know that I was in the office on these days. So if we had to work back, we could know who the exposure was to. To be honest, I haven't seen it on every site that there's that detailed information, but if you have it, it's extremely helpful. In some cases, we've seen some of our subcontract partners do an excellent job of their own screening process, and then they kind of share it with us on a daily basis. So that compiled with where the workers are working is very helpful if you have an outbreak, which, from a risk mitigation perspective, those steps can sometimes allow you to maybe keep a site open, knowing that, if worker A is starting to exhibit symptoms, but worker A wasn't exposed to anybody else, then it lowers the risk for everybody else and the anxiety level, right? So it is a good precautionary step.
One of the questions I'm seeing here on the sidebar is also is whether or not a positive COVID-19 would be considered a serious incident on the job site. So I'm assuming serious incident is a workplace safety and health classification where certain procedures and policies must take effect. Does anybody want to jump in on that one? Is a positive COVID positive on a job site considered a serious incident?
So just for the folks on the line, Andrews probably can give you the Manitoba definition and whether it needs to be reportable. I know in Ontario, if we have a positive case on one of our sites, we need to report that to the Ministry of Labor so that they can do their appropriate investigation.
Can you weigh in on that, Andrea?
So I think every circumstance is going to be different when it comes to cases of illness or any other type of case on a site. Whether or not it's black and white considered a serious incident, I can't answer that right now. But what I can say is that something to be considered, and I guess there's two very different approaches to cases on site where there would have to be some type of evidence of workplace transmission. That's a very different thing than just having a worker on a site with a positive COVID result. So I think there's a couple of things to consider there. But as to black and white answer, I can't answer that right now. I would have to double check to verify for sure.
Okay. Sounds like talking to my lawyer. Everything is, it depends. Moving on a little bit, Manitoba is currently on the scale of, 1 to 4 in the orange category. Certainly the metropolitan region is in that area. I noticed that there's a few care homes in red, but what would happen, and maybe this is a bit navel gazing on the part of our panelists today, but what would happen if Manitoba moves to red in the Winnipeg metropolitan region or in the province in general? It's more of a critical situation, and I know there, if I can read from one of the COVID documents we have, COVID-19 is not contained in this situation of a red situation, sort of level red. COVID-19 is not contained and/or there are significant strains on our healthcare system. The virus is being transmitted at levels that public health and the health system cannot manage. Extensive community transmission is occurring, and under this level, non-critical workplaces could be closed. So, does anybody want to speculate what may happen if Manitoba gets to that point?
I can offer just a little bit from experience that we had here in Ontario, and I kind of shared at the beginning, but I think for one thing, for sure, you're going to see worker anxiety increase, but that's probably kind of obvious. But from a construction site perspective, I think the government's going to take a really hard look and go, what's essential to keep going? Because really, you got a lot of workers moving around in the construction industry, and the more you can reduce that, the more you can potentially reduce spread. So that's what we saw here. And the other part of it is just, even if your site is deemed essential and you can still operate it, getting back to that worker anxiety, I think you got to be prepared to start looking at, okay, what does the shifting look like? One of the things that we've seen that, I think even the existing occupied condos are wondering is, we got a lot of vertical construction here, and how do you get workers loaded on a site when it's a 30-story site with one hoist that you used to put 12 to 15 workers on that now you're putting 4 to 5. But, I think it's just getting your head around that the number of sites open is going to reduce, and potentially the number of workers that want to work in the short term will reduce.
John, did you want to weigh in on that one?
Yeah, no, absolutely. I think again, the challenge that anybody actually has is when the government actually starts identifying or telling you what you can or cannot do. And I think Kelly hit the nail on the head in terms of you'll be identified if this is an essential service and you do have to stay open. Now, what are you actually going to do? One of the documents that that we have available that that we can share, and I'm not sure if Peggy or Darryl want to actually throw this up, But in terms of our government here in Manitoba, they've identified the pandemic response from green, yellow, orange, and red. In terms of red is that critical where they literally, there's extensive transmission of the virus. It's not controlled. What are they actually going to do? For our office here, we actually came up with CSAM response in terms of what are we going to do to mimic or mirror what the government is suggesting. And one of the key things that we're very cognizant of is that we are here to serve the construction industry. So if there's something that we can do, we will remain open in terms of non-essential staff will be sent home. And this is just at the very bottom under the red critical. From our perspective, our response will be all non-essential staff will be working from home, office doors will be closed, and we're going to have no site visits. So this is super generalized, and I realize it's for an office environment, but at least it identifies some generalized. And we actually had a communication originally prior, and this was September 2nd, that we sent to all staff in terms of what our response would be, particularly with the concern that kids are going back to school, there could be higher transmission that's happening. So we actually, to Kelly's point as well, is that we had sent out a very detailed communication to our staff in terms of what are we doing and how are we actually going to respond. And this was just a supplemental document that we put in place with our overall communication to our staff. And what we've found is that, yes, there is a lot of anxiety that may be dealing with, what if I get it? Or what if I, more importantly, not just with myself, but what if I give it to my mom or give it to somebody else that cannot actually withstand the virus itself? So that anxiety with people, it is very much relieved with very open and honest communication and detailed explanation of what you will be doing in terms of controls that have been put in place. So this is just a sample. I just wanted to share. And again, if you'd like to follow along suit, or we can send out the Word document and you guys can change this how you see fit to suit your own needs in place.
Thanks for that, Sean. And certainly every company is going to have to make that call if in fact we get into the red zone. And construction is allowed to continue. Certainly at the beginning of the March or middle of March, there was a lot of angst among trade contractors that were working on larger construction sites, and without access to hand sanitizer, et cetera. There's a lot of anxiety, and I think we've learned a lot since that, and hopefully some of that some of the knowledge we've learned is going to be applied as we move forward. And hopefully that anxiety level will be less. I will also say that Winnipeg Construction and many other associations participate in a weekly call with government, the group that is managing this. And we hear and see the health orders as they're being developed. And that's really the key as to what we're allowed to do and which industries are allowed to continue. So we'll be watching those very closely. Kelly, you mentioned elevators and policies and procedures for access to the site. Are there any, can you think of any other work site organizational options that have been particularly effective that you might want to share with the industry?
It's interesting. We kind of at the height of things, we had a group of our major subcontractors. We got on a call with them every week and just said, hey, can you share any lessons learned or best practices that you're seeing amongst the industry? And, it's going to sound like overly simple, but one of the things they said was, well, one contractor is simply using one set of stairs up, one set of stairs down. And, it sounds simple, but it's super effective. And sometimes those, in heightened anxiety times, sometimes people just look right over the obvious little steps you can take to make your site flow a little bit better. So, that one we were like, okay, well, that's a no-brainer. Let's do that. And then, somebody put up almost like a little bit of a curtain system in some of the hoists, just so that you could put more people in it. And then we lobbied the city of Toronto. The noise bylaws here get a little funky at times. So we talked to them and said, listen, we want to be able to start loading the building early. So, we started to kind of offset and stagger shifts a little bit, not only for loading the building, but even for our own staff. Call it project management or superintendent that was located on site, just stagger them in case you all of a sudden have an outbreak. You may have the teams working from home for 2 weeks and then staggering over. So there's lots of little tips and tricks that we went through, especially at the height of things. But sometimes it's just getting all the partners around the table and trying to take a look at the specifics of your site and what you can do to maybe just keep people a little bit more spread apart, right?
That's excellent. One of the other questions I'm seeing on the chat line is, and this, I think we can all appreciate this one, and certainly Dr. Rusin has been repeatedly suggesting that for whatever we do, we don't stigmatize someone that may or may not be infected with COVID, and in doing so, you potentially stop them from identifying and coming forward. But have you any advice to workers that are on site, or managers or superintendents on a construction site, where they think someone might be ill and just doesn't want to self-identify or isolate?
We had one individual that was on a site, and she had I guess the mother in the household was in the healthcare business, and there was a fear that maybe a contraction had occurred. So we were advised by the employee, and they self-isolated, and it turned out that they did have it. And so they were able to self-isolate for the full duration. But the greatest thing that happened there is that they were proactive in self-isolating, and really they saved us having to shut down a site. And so, from a leadership level, we reached out to the employee and just thanked them for having the wherewithal. And I think it's just, we have such a culture, I think, especially Canadians, that coming to work and coming to work, even if you're not feeling up to snuff. And when you do stay home, you feel guilty. And I don't know where we got to that, but it's probably a lot of our upbringing. But I think you just got to change your mindset on that. If you're not feeling well, stay home and get your work done there if you can, and come back when you're 100% and go from there. So I think it's just changing the culture a little bit, right?
Yeah, certainly appreciate that. Well, we're approaching 10 o'clock. I think we're actually there. And we've got about, 10 or 20 questions that we need to deal with. So what we're prepared to do is to, among panelists, we'll share the questions, come up with some answers, and share them with those that we'll send you an email or post the list of questions and answers that we received somewhere on our website, or email them directly to you. Any last comments, anybody on any of our panelists before we wrap this up?
I just say thanks for having me. It's a great picture in the background. Unfortunately, we haven't been able to visit home for a while, but we're looking forward to when we can. So again, thanks for having me, Ron.
Thank you. Andrea?
Oh, I think that was great. It was an excellent opportunity to share some information widespan to a number of employers. So thank you.
You're welcome. Thank you very much. Sean, any last words?
Yes. Yeah. If you'd like to stay on for another couple hours, I'm happy to continue speaking. But one thing I just, again, want to point or make reference back to constructionsafety.ca. We literally have a fantastic website that has tons of information from credible sources to assist. And most importantly, if you have any questions or concerns, we are your safety association, so contact us at any time, and we'll do our best to ensure that you get the appropriate information or point you in the right direction. That's it. Thank you all.
Thanks for that, Sean. And